Today we're having an update on plastic surgery with one of Palm Beach's top plastic surgeons, Dr. Frederick Barr. We're talking transformations here. Stay with us. Dr. Barr, what is your focus?
The focus that I'm trying to put out to the public is that I can do things here in the office under local anesthesia, no pills, no IVs, safely for small areas to define the different areas that we're trying to achieve. For example, the mini face series. So at the moment now, what we've done is on this side, we've done nothing, but you can see how our lines are in here. And on this side, relax for a minute, you can see that we've been working on those lines here in terms of how they're filling out. So we're going to continue to work on those lines because of providing it. On this side of Susie's face, she has some lines that are here. We haven't done anything yet to those lines, but the same lines over on this side we actually now have injected and seen them come out. In order to maintain what we're doing now, Susie really ought to be on a skincare program, which we also have here, which provides for the skin moisturizing and protection against the sun, cosmetics in terms of camouflage, for the brown spots, discolorations, things of that nature. We really want to be careful from the environment. That's what we're working on. Here's a little something that's wonderful too, and we'll just do this. I'm going to show you. So we're going to build up her cheek. So not only have we the ability to do the lines themselves, this is a wonderful molding agent to make changes and complement the natural structures that the patient has. So for Susie, she's got beautiful cheekbones, and we're going to go ahead and make her cheekbones a little bit more. Okay. If you want the eyes down. Doing great. You all see the difference?
Yes, it's incredible.
Isn't that cool? And just breathe up. It's wonderful.
I'm going to look good for 72.
We have patients in their 90s that will come in for injections.
That's so cute.
If they have the ability to have a mini lift and they've been cleared by their doctor,
Why not?
why not? And I think that what we've had, 86 or 88, was the upper range of patients that we've had.
We had 85. They call themselves 85 plus.
How safe is it?
It's incredibly safe. If a patient is healthy, and of course we have everybody see their internist and get what we call a clearance, all I'm using is a local anesthetic only with xylocaine with possibly a little bit of epinephrine to it. So it's almost as if you're going to the dentist, except we joke, we say you can talk during the procedure. So there isn't afterwards the emergence phenomenon that you would get from general anesthetic. There isn't that slug of anesthesia that's going to be in you for several days afterwards. It's not a hospital stay. You walk in, we do the surgery, we inject one side at a time, we're doing the facelift. There's a break in between. Afterwards you walk out, and hopefully most of the time you're back doing whatever you're doing the next day.
How long would you say recovery time is on an average?
It depends on each individual, but stitches are out between 5 and 7 days. Up until that time, we really encourage patients to get back to the routine activity. Again, because there are many procedures, there's limited in focus, they're limited in what actually we're doing, so recovery time is rapid, bruising, swelling is limited to those areas, and that's what we're trying to accomplish.
How quickly would you say you could go back to work?
Let's say someone did it on a Thursday, we encourage people to be back at work on a Monday.
How should you advise patients ahead of time to be proactive in their own health care prior to surgery? What are some of the tips, things people can do?
Lifestyle issues are always important today, just like every day. It's always been in the past the same. Diet and exercise, diet and exercise. We have to really pay attention to ourselves. Taking care of ourselves is the most important job that each of us has. So when we get to that place of saying, I'm doing all that I can, whether it be for a mini face series, which is for aging of the face, or mini liposuction. Again, small areas of diet, fat resistant areas. Patients have done all their work, they've gone to the gym, they're doing their their dieting and all that, but they still have those areas where we store fat.
You just had surgery. This is your second time to have surgery with Dr. Barr?
Second time, yes.
And how do you feel?
I feel great. I'm ready to go work out tonight and go back to work tomorrow morning.
You mean he can actually get up and go back to work?
We want him to. That's the idea. We want him out and about. We want him. Part of the safety is fluids and movement.
But you look great already. What made you choose liposuction?
Well, a year ago I had some problem areas that were diet and exercise resistant. So this procedure, after I found out how simple it was, really finished off what my goals were.
Men typically get stomach fat, flank fat, what we call love handles. Women are usually thighs, inner thighs, and it depends on the person. Everybody stores fat differently.
So the fat won't grow back in the same location? It will grow back in other locations, Dr. Barr?
No. What will happen is the fat will grow back in the same location if he doesn't maintain his diet and exercise.
His vigil.
Exactly.
Dr. Barr, why are more men coming today for plastic surgery?
The same reason that women are coming, because they want to look better. Everything is out there. It's about a visible world, particularly in South Florida. I mean, there is no other place maybe aside from France or Italy or California where people really show their skin more than in South Florida. And honesty is the most important factor out of all this.
Is it ever too late to have plastic surgery?
It's only too late if, one, your medical condition doesn't warrant it, and we have picked up a lot of different issues on patients. We have one patient who was here the other day, never knew it, hypothyroid. And hypothyroidism can contribute to being overweight, thick skin, losing of hair, coarseness of features, all these things that patients don't necessarily put together, but as students in medical school way back when, we really began to understand that it's the complete system. Medicine is interlocking. That's what the beauty of medicine is. And hopefully today we're able to work towards those goals. We haven't reached gene therapy yet where we can just put in the new DNA and get a new or less aging going on and a new heart and so on and so forth. We're working on that. But until we get there, these kinds of surgeries where they are safe, where they are effective, where there is comfort for the patient, where the patient really will get the benefit with less downtime, less of the fuss and muss from the past. In the past, we used to wrap patients up with all these things. We don't do that anymore. Times have changed, and thank God for that.
It's so wonderful being with you today. Thank you, Dr. Barr.
I appreciate
to
the
be
opportunity.
continued.